In the complete hemodialysis series, we have seen many components of dialysis. Today, one procedure we are going to see an intro. What is plasmapheresis? Plasmapheresis. This comes under the broad terminology apheresis. That is nothing but separation of the blood components. If you take blood, plasma, red blood cells, white blood cells, platelets, these components are there. If we are separating one from the other, that can be called as pheresis, apheresis. Plasmapheresis means separation of the plasma from the other components of the blood. Similarly, RBC cytopheresis is there, thrombocytopheresis, platelet cytopheresis, we can call leukocytopheresis. These are other terminology we say for the separation. In the dialysis unit, for some rare disease, for example, Guillain-Barré syndrome, anti-GBM disease, even in transplant, we do the procedure Plex, Plex, also called as plasmapheresis. Sometimes if we replace it with the fresh plasma, that is called therapeutic plasma exchange. Therapeutically, we are exchanging the plasma. And there are various techniques to do that, how to separate. In this, you are seeing a dialyzer. Most of the dialysis technologists or the residents might be knowing this particular structure, dialyzer. Plasma filter will look almost exclusively similar to as dialysis. This one, dialyzer. In that particular technique, if we use a hollow fiber plasma filter, there are two techniques. If we use the hollow fiber plasma filter, also called as membrane plasma filter, that will appear just like this. The another one, centrifugal method is there, that is being used in the blood bank. In dialysis unit, mostly we use the plasma filter. The image of the plasma filter I will give in the background. You can see just both are almost similar. But what is the difference? Difference is here in the dialyzer only the water will come out, basically the ultrafiltrate. Whereas in the plasma filter, the structures are a bit modified. The plasma itself will come out. The plasma which contains all the molecules, the proteins, cytokines, whatever the components of the plasma, because of the high pore size, along with the molecular cutoff. What is molecular cutoff? The particular component is being removed, especially the immunoglobulins, those things are removed. What are the components removed? That we will see in a separate video, but just remember the entire plasma can be removed. No need for the dialysate when the plasmapheresis is occurring. Do we need special machine for that? It depends on the blood flow and the machine configuration. Mostly in a normal, the machine that you are seeing in the background, plasmapheresis can be done. At a lower blood flow, we have to keep on an average 50 to 100 ml per minute. The blood flow have to be done. With respect to the further details, very difficult to give because there are further modifications are there. Dialysate won't be there. The vascular access remains the same. Blood flow is low, and what rate we are removing depends on the indication. And as we remove the plasma will be replaced. That is FFP, fresh frozen plasma from the blood bank from the donor we will be taking. And this is, since the current also went off, we'll stop here. There was some interruption there. So this is the intro. Why we do? Whenever we want to remove the toxic component from the plasma, for example, anti-GBM disease, for example, in the transplant if antibodies are there, Guillain-Barré syndrome, even acute liver failure, grade C indication. Many other indications are there, we will discuss it separately. At least for the intro, just remember the dialyzer and plasma filter can appear the same, but the membrane is different. That removes the plasma. It removes only the water, not the plasma. So this is an intro regarding plasmapheresis or TPE, therapeutic plasma exchange, since we are exchanging the plasma. Indication and further anticoagulation probably we'll see in the next video. Bye bye.